Have you ever wondered how blood is supplied to our lower limbs? It's quite a fascinating journey blood takes to reach every muscle, bone, and skin tissue of our legs and feet. This journey starts from the heart and is facilitated by a network of arteries, each with a specific role to play. The primary supplier of blood to our lower body is the abdominal aorta, a major artery that originates from the thoracic aorta within the chest cavity. Descending down the back, it splits into the right and left common iliac arteries at the level of the fourth lumbar vertebra. These common iliac arteries further divide into internal and external iliac arteries, each branching out to supply different regions of our lower body. This intricate network of arteries ensures that every part of our lower limbs receives the oxygen-rich blood it needs. Now we delve into each artery, starting with the abdominal aorta. The journey of blood to our lower limbs begins with the abdominal aorta. This vital artery originates from the thoracic aorta in the chest cavity, making its way down the back to the level of the fourth lumbar vertebra. As the main blood supplier to the lower body, the abdominal aorta plays an essential role in keeping our legs and feet functioning optimally. From here, the abdominal aorta bifurcates into the common iliac arteries. This is where our journey continues. Meet the common iliac arteries, the next stop on our journey. These two large arteries spring to life from the bifurcation of the abdominal aorta. They journey downwards into the pelvis where they each assume new identities. The common iliac arteries divide into the internal and external iliac arteries, each with its own unique path and purpose. These arteries are the gatekeepers, the vital link between the abdominal aorta and the lower extremities. Next, we will explore the internal iliac arteries and their branches. The internal iliac arteries have a crucial role in supplying blood to the pelvic region. These arteries branch off from the common iliac arteries, journeying into the pelvis and further dividing into several key arteries. Each of these branches has a specific role in powering the body's functions. The iliolumbar artery, for instance, takes responsibility for supplying blood to the muscles of the lower back. In contrast, the superior and inferior gluteal arteries focus on the buttocks area, ensuring the deep muscles in this region receive ample blood supply. Another critical branch is the internal pudendal artery. This artery is the primary blood supplier to the external genitalia and perineum, highlighting the importance of the internal iliac arteries in reproductive and urinary functions. In essence, the internal iliac arteries are the lifeline for the pelvic organs, the buttocks, and the lower back. The other branch of the common iliac artery, the external iliac artery, continues down into the thigh. Now, we venture down the thigh with the external iliac and femoral arteries. The external iliac arteries, extensions of the common iliac arteries, continue their journey into the lower body, coursing down into the thigh. Here, they undergo a transformation, becoming the common femoral arteries. These arteries are the main suppliers of blood to the thigh, a crucial role in maintaining the health and function of the leg muscles. The common femoral artery then parts ways, bifurcating into two significant branches: the deep femoral artery and the superficial femoral artery. The deep femoral artery, also known as the profunda femoris artery, takes up the task of supplying blood to the muscles of the thigh. Meanwhile, the superficial femoral artery, the continuation of the common femoral artery, travels down the medial aspect of the thigh, preparing for its next leg of the journey. The superficial femoral artery continues its journey into the popliteal fossa. Our journey continues with the popliteal artery and its branches. The popliteal artery, a key player in our circulatory tour, is the continuation of the superficial femoral artery. Nestled in the popliteal fossa, the hollow at the back of your knee, it provides vital blood supply to the knee joint and the lower leg. From here, the popliteal artery forges two paths, dividing into the anterior and posterior tibial arteries. The anterior tibial artery takes the scenic route down the front of the shin, nourishing the muscles and skin of the anterior compartment of the lower leg and the top of the foot. Meanwhile, the posterior tibial artery heads down the back of the shin, delivering blood to the muscles and skin of the posterior compartment of the lower leg and the sole of the foot. Let's not forget the perineal artery, a smaller artery branching from the popliteal. journeying down the outer aspect of the lower leg, providing blood to the lateral compartment. Finally, we reach the foot with the dorsalis pedis artery. We conclude our journey with the dorsalis pedis artery. The dorsalis pedis artery, often regarded as the final destination in our expedition through the lower limb arteries, has a vital role in the circulatory map of our body. This artery is a direct continuation of the anterior tibial artery. It makes its way down the front of the shin, finally reaching the ankle and the top of the foot, known as the dorsum. Just like the other arteries we've discussed, the dorsalis pedis artery has a crucial job. It is responsible for supplying life-giving blood to the muscles and skin of the anterior compartment of the lower leg and the top of the foot. It's interesting to note that you can actually feel the pulsation of the dorsalis pedis artery. It's palpable on the top of your foot, just off to the side of the extensor hallucis longus tendon. Now, let's take a moment to recap our journey, starting from the abdominal aorta and culminating at the dorsalis pedis artery. We began with the abdominal aorta, the main blood highway for the lower body, branching off into the right and left common iliac arteries. These further subdivided into the internal and external iliac arteries, supplying blood to the pelvic organs, buttocks, and lower back. Next, we encountered the femoral arteries, the common deep and superficial. These arteries are responsible for supplying blood to the thigh and knee. Down the line, the popliteal artery took charge, providing blood to the knee joint and the lower leg. We then followed the anterior and posterior tibial arteries, each taking a different path down the shin to the ankle, servicing the muscles and skin of the lower leg's anterior and posterior compartments. Finally, we arrived at the dorsalis pedis artery, carrying oxygen-rich blood to the top of the foot. Each artery, in its unique way, contributes to the complex and efficient system that keeps our lower limbs alive and functioning. And so, we have traced the path of blood supply to our lower limbs, one artery at a time.